So what have been the usual routine indications in which we have been using this procedure, sir?
Right. So transcatheter aortic valve replacement represents a non-surgical methodology to replace the aortic valve.
Right.
And in times immemorial, the only way to change a valve has been open heart surgery.
Correct.
Put a patient on a cardiopulmonary bypass, open the chest, open the heart, and then replace the valve manually and stitch it in. The transcatheter aortic valve replacement is a catheter-based technique done in the cath lab, almost like an angioplasty. And in fact, it's interesting that the first in-human study started in 2004. We were the first ones to actually do this study in 2004, and then we were the first ones in India to actually start the transcatheter aortic valve replacement on a compassionate use through permissions from the Drug Control of India in 2012. And from there on, the device got approved in 2016, October, and now more and more patients are receiving the benefits of this therapy. So actually, how do we decide about whether we do surgery or transcatheter aortic valve replacement? So actually, the whole stuff, firstly, of course, this is a disease of the elderly. Aortic valve disease is usually a disease of the elderly. And anywhere from 70 years of age to 90 years of age, the valve can actually narrow up. And therefore, if it narrows up, it puts a lot of strain on the heart. And by the time people start feeling breathless and can have unconsciousness, even heart attacks or sudden cardiac arrest, and by the time they get symptoms, the average survival is only 2 years.
And the rehabilitation will be much quicker in cases of transcatheter, I believe, as compared to the surgical.
You're absolutely right, because it is the patient is eating normally that very evening, is walking around the next day.
True.
As an elderly, it's very important to have them walking around earlier, so they've got no bed immobilization.
True.
And they're practically ready for discharge often on the second day, along with other angioplasty patients. And when you look at these patients who are 80, 85-year-old, even up to 90-year-old, it's heartening to see that through a simple procedure, they're standing the next day and walking around, and in fact are even saying that, have you really done anything, because I feel so well.
True.
And because the aortic valve is immediately replaced and starts functioning well, patients feel well the very next day compared to what they were before surgery. So yes, it is remarkable in terms of the least morbidity it offers to the patient. In fact, it's already been shown that in the first year, the quality of life given by transcatheter aortic valve replacement is far better than surgery, primarily because there's no immobilization and patients back to normal within 48 hours.